I'm joined by two staff members from the New Mexico Coalition Against Domestic Violence. Pam Wiseman is director, Gwen Cadis is policy coordinator. Thank you for joining us today on New Mexico in Focus. Why is it so problematic to have stay-at-home orders for people for whom home is not a safe place because of abuse?
Well, people that are abused tend to be isolated by their abuser to begin with. And so this furthering of that isolation can be really dangerous for someone who is kind of stuck at home with their abuser. Probably the kids are around too. And so the abuser might have put some limits on, keep the kids quiet or whatever it may be. And it's just a very dangerous situation. Victims can't reach out for help often because the abuser is there. So that makes it a really dangerous situation.
I'm guessing unemployment, which is, of course, skyrocketing right now, is exacerbating that.
Absolutely. That's a huge risk factor.
And you are a statewide agency. You work with a lot of local resource centers. What are you hearing right now from various communities and the challenges they're facing?
So there are about 30 domestic violence organizations around New Mexico, and we work with all of them. And we're in contact almost daily with them, and the challenges are enormous and like nothing anyone really ever expected. The questions that are coming up, the barriers are really surprising, I think, to lots of people. One of the barriers, and it's a barrier that most programs never had, is they don't have enough food. And in general, these programs, which are shelters, have not had that issue because communities are really generous and they bring food and they have food banks, and the same with supplies. But now food is harder to come by, supplies are harder to come by, and people aren't going out. So they're suffering from shortages of both food and supplies, especially cleaning supplies, which they need.
Is there a danger because of that people might leave the shelters and go back to their abusive situations?
I think that's always a risk, and that's a fear. I think the main fear that our programs have is what happens if someone comes into their shelter and is positive or presumed to be positive, and then what happens to all the other people who were in the shelter, what happens to the staff. So we've been working really closely with the state, with CYFD, with Department of Health, to arrange hotels and alternate locations for people. But it's really been logistically hard to do because we, for the last 35 years, have never had to do anything like this before.
How are you and other agencies around the state adapting your services to try and meet the needs of victims where they are?
Yeah, I can answer this, Gwen, in several ways. For example, many programs have services not just for victims and their children, but also for people who commit domestic violence. They're ordered by the courts to attend groups. And so they are doing Zoom meetings, they are doing phone calls, sometimes just with individual people, because not everybody around the state has internet access or has a computer or even has a smartphone. So they're doing that kind of work. And that's really important because it's even more critical now that people who have committed domestic violence also have some support, someone to talk to, someone who's kind of keeping track of what's happening. So that's really important. Their shelters are open, their programs are open, the 24-hour hotlines are open. They are all still doing the work. They might just be doing it differently.
What you brought up, the court might order certain things. What about court services right now? Because can you get a restraining order? Does it even mean anything to get a restraining order right now?
Well, it does mean something still. And yes, people can get the restraining orders at this time. We're working very closely with the courts and with legal services to try to keep that avenue open for victims to use when they need to use that. So we're assisting on the phone with with letting victims know about petitions and questions that they may have. There are some barriers still to that, especially when people cannot get out of their house to go sign a petition. So we're working on those kinds of issues right now.
What can a victim expect if they call you or one of your organizations that you work with if they're trying to get out of a situation right now? Like what happens? What's the process now?
So what happens is, first of all, somebody will assess their immediate safety and get them help if they need immediate assistance. That's very important. Then what will happen is people, advocates are on the phone who will talk with that person about different options that may be available, and then see what that person wants to make use of at this point. Sometimes people just need to talk. Sometimes people need emergency shelter when they're in danger.
If it's risky to make a phone call, are there other ways they can communicate?
So there is the National Domestic Violence Hotline offers chat services and text services so that they don't have to talk and possibly be overheard by the abuser.
We can put those numbers on our website as well. So they can also do online help or reporting, right?
They can actually get on a website to the National Domestic Violence Hotline, and they can chat with somebody on that website. And then the hotline can refer them to whoever their local program is if they need those kinds of services, shelter, advocacy, counseling.
What about? Also go ahead, Pam. To our website, nmcadv.org, which is New Mexico Coalition Against Domestic Violence .org. And on our website, we have a map and a list of every program in the state so they can find out which program is nearest to them and get a contact there too. And we also have lots of other help, just basic information about domestic violence, about services for children, lots of I think helpful information for victims and for the community also.
What about people who may not speak English?
Right. So we have funding through the Crime Victims Reparation Commission, and they provide a language line. They give us the money, and we pay for the language line, and people will respond in virtually every language. I'm not sure if there really are any that. There may be a few, but in almost every language, because obviously there are a lot of people who are don't speak English, and it's really important that we be able to serve everyone in the community and not just those people who speak the one language.
So if they call a hotline, they can be connected to someone who can speak in their language. Okay.
They have access to a crisis line that will do that.
France just announced a really big program to assist domestic violence victims. It includes thousands of hotel bookings I think the government is paying for. They're setting up assistance points at places like supermarkets and pharmacies where we can still go, even if we're sheltering in place. Do you think any of that's feasible here?
It's definitely feasible, and we've been speaking regularly with representatives from CYFD and from the governor's office. So we're hoping to have something definitive tomorrow to let our programs know about. But yes, those things are feasible. They're happening. Plans are underway. And we've been really impressed with the level of thought and analysis that's gone into that, and the understanding of the special needs of domestic violence victims that people working on this problem have really shown. And so we were really pleased about that.
What is needed right now to address this as we continue with this crisis and restrictions on movement?
We need to have people aware that the services are available, and that if you hear something maybe in your neighbor's house or you're walking by somewhere, please call 911 because that person might not be able to. Also, our programs are really in need of supplies, cleaning supplies, food. You know, we had a situation where one of the shelters went to get milk and they were restricted to getting 1 gallon when they have a shelter with maybe 7 children in it. So those kinds of things are really needed right now by the programs.
Okay, well, thank you all so much for talking about this. We'll put this information on our website as well.
Thank
Yes.
you.
Thank you for giving us this opportunity. We appreciate it.